had the technology to do so. And Rogers is even going as far when we had patients that were appropriate for telehealth but did not have, laptops. We have an angel fund that we're even able to purchase laptops and send it out to them so that even those patients were able to participate in the telehealth services as well. But yeah, there was, some pushback. Some patients were nervous about it. Some patients, were worried that they weren't going to get the attention or that it wouldn't be as successful. But overall, in all the programs, we've seen the clinical effectiveness very good. And those patients that were anxious about it in the first place, an overwhelming majority of them have gone on about how much they've enjoyed the telehealth services and how much they've gotten out of it. A few of our clinics have had a few people on site during the pandemic as well, when we had some, not here at the Appleton location, but some of the other locations where we might find a client that just wasn't appropriate for telehealth. They needed a little bit more, higher level of care, or just were not tech savvy enough to be able to keep up with the telehealth. And of course, we still had patients the entire time at our inpatient hospitals, but the regional clinics were pretty much almost entirely telehealth, other than the few exceptions of some patients that just were not able appropriately to do so. We found the programs that some people struggled in the most were the eating disorders or the addiction programs. The overwhelming majority of them did very well through the telehealth, but there was a few that just, struggled with that a little bit. We did have a few discharge and decided to wait till we go back to in-person, which will be coming very soon. But most of the patients have found that they were able to really connect and have been incredibly grateful that we were able to continue to offer those services throughout this time, when a lot of other clinics have either closed down or, at least temporarily or even permanently, especially in the Wisconsin area. Most of the outpatient services, a lot of the addiction clinics and everything were closed down. So we were just inundated with calls on people needing help and needing services.
Wow. That's interesting. George, I know you definitely would be, kind of interested in hearing how demand spiked. You got any questions for Char here?
Yeah. I mean, I think just to follow up, a lot of people kind of underestimate the complexity of going to telehealth, right? A lot of our clients call in, hey, we wanted to go to telehealth. And it's like, well, how are you going to handle this? How are you going to handle that? And there's so much that goes into it that I think people don't realize. So huge testament to you guys and your team for coordinating all that. On the demand side, I mean, did you guys have specific marketing programs that you were running that would promote that you had telehealth, or was there just overwhelming demand from competitors being closed? I mean, how did you market the transition either to the public or to your existing patient base?
Great question. The first step was, educating our existing patient base that we had, that were already in the clinic, because we had patients who were here in the clinic that then had a transition to going to home. So educating them on, how to use the services, how to join Microsoft Teams. You have to make sure that, one of the biggest obstacles was making sure that everybody had privacy, because the groups have to be very private. So any participants in the group, they needed a quiet room at home where, nobody else could hear or see their screen. We did occasionally have some issues where, a client might have a spouse or somebody walk in the room. And, that is, obviously something that is against the rules. So we would have to speak to the patient about making sure that they were keeping the other patient's privacy protected. But overall, our team has done very good at screening that to make sure those protocols were still put in place. And right now it's unsure how the pandemic is going to pan out. I have a feeling, we call it Rogers Connect Care, that we will continue to offer some of those services as long as insurance is reimbursing for them, even after the pandemic, to try to help those who aren't near the location or might be better off by telehealth. But right now, we are actually even starting the major project of doing the opposite, which and that's trying to transition everybody back to the clinic, including the staff. You'd be surprised how many little details go into that. So that's also been just a lot of planning and a lot of great team coming together to make those little details happen.
And is there any marketing campaigns planned externally, as other competitors come back into the marketplace to ensure that the momentum continues that you've been able to get so far?
Yeah, I missed the marketing end of that on that last question. We, as far as the marketing beforehand, we continue to do the same marketing that we did. And we also, let our outreach team let our referral partners know that we were still in business and still, had our doors open and were, taking participants telehealth. Our doctors did some educational videos for both our referral partners and for clients that might have been on the fence to kind of educate them on the clinical effectiveness of the telehealth programs and exactly how that worked out, because some patients did have some anxieties calling in on it. But we also, across the board for most of our clinics, had waiting lists prior to that. So really, we had so much demand for even prior to going into telehealth that the marketing outreach services definitely, helped. But I wouldn't say that we had the need for it as much because we already had so many patients on the wait list. It just helped us pretty much eliminate our wait lists and get everybody that had been waiting for treatment to get into treatment. And then the outreach referral partners that had closed their doors, especially for outpatients, knowing that we were open, if it was, if they were appropriate for the IOP or PHP level of care, they would still send those referrals over.
Got it.
Yeah, I think there's awesome insight here, Char. Like when you think about, a brand promise, right, or a commitment that you make to your patients and, focusing on the patient experience, to really unpack having to say, okay, there's a pandemic, we have to have a certain amount of space between each other. But instead of abruptly stopping your treatment, we're actually going to invest, we're going to think, we're going to strategize, we're going to figure out how do we continue this, from a distance. I think that's something, just awesome to actually do. But then as now you continue, it really shows that you guys stood behind, your promise and your commitment to, the patients that you were taking care of, because it's easy to just not be able to think, right, that intricately strategize and, get every point and think about, okay, offering telehealth to new people. But there's, like you said, people that you were actually servicing that were in the middle of treatment that you wanted to try to continue to service. So I think that's extraordinary. How did you get to the New York Times? How'd that happen?
The New York Times, I guess, just picked up on it somehow, and they wrote an article about it because of, the fact that we were, doing, 6 hours of PHP programming a day completely by telehealth, which is, as far as I know, I've never heard of another company out there doing it. So, it was sort of a unique undertaking, especially from coast to coast with all the different clinic locations we have and all the different patients, converting all of that. So I guess, New York Times just picked up on that, and they wrote an article about, Rogers Behavioral Health going on to continue to offer services, through telehealth.
That was probably all of the marketing you guys needed.
Yeah, I'm sure that probably helps some too. Yes.
Absolutely. And then I think, lastly, just, all of these revelations and, everybody talks about the new normal or returning back to normalcy. But it seems like there's a lot of things you guys learned that you think is going to continue, as you move forward. Could you share some of those things with the audience, some things that you feel like, hey, we've tried this, we executed on this, and we're going to continue to do this? You touched on it a little bit earlier, but.
Yeah, it's still a little unknown because, again, it comes down to what regulations are going to allow. During, the COVID pandemic, we, and I'm speaking of it like it's over, but obviously we're still in it, but we're getting towards the end there. There's certain regulatory and insurance restrictions that were lifted. A lot of companies, most insurance companies out there, other than a couple we had to wrestle with, they allowed us to continue to bill for the PHP services, via telehealth, which again, we would like to continue doing telehealth to some extent afterwards, but that's going to be dependent on, the insurance companies, allowing it. We also had our doctors, at that point, we were able to open things up so that our doctors were able to do centralized reviews, throughout the country, which means they were servicing patients in states that they may not have had a license in. And regulatory issues allowed us to serve some patients that were either, sheltering at home in a state where we may not have been licensed in, but their primary state was in a state that we were licensed in, or just a state where we didn't have any licenses at all, but people were looking for help. So those regulations were lifted quite a bit, which allowed us to do many of the things we did. Going forward, we'd have to look at, either, getting licensed in some of those other states if we wanted to continue to offer those services by telehealth, but also making sure, again, that, the insurance companies are going to reimburse so. But if all that goes well, we do plan on probably keeping some kind of the Rogers Connect Care telehealth still going in addition to the in-person clinics when we move back in.
Gotcha. Yeah, I mean, that's an interesting point as well. I mean, there was a point where a lot of things were just automatically allowed, because of the urgency of the situation, and then actually going through the, proper protocol and finding out if some of these things will be permitted is kind of a whole nother journey and world. So, yeah, I can definitely understand that. As you guys, made some of these adjustments, during the pandemic, could you tell us a little bit about, how you guys rolled out maybe training for clinical specialists and intake agents and, okay, you're doing new things. You have to do these things extraordinarily quickly, right? Was training, centralized, were there one-offs, how did you guys execute training?
Great question. Rogers as a company in whole did a lot of standard work procedures that went out to all the different locations, but each site has, some unique, unique specifications that, we might have done a little bit different or varied from that. Right. But as far as, some of the training we did is for the intake team on how to educate people about telehealth, making sure that people had the technology and were appropriate for the telehealth level of care. On the clinical side of things, there was a lot of training that went into it. But to give you a couple of examples, one of the things would be safety checks. We have to, the clinicians were, with Microsoft Teams has now recently changed where you could see 9 people on the screen at a time, but for a while there was only 4. So if you have, 15, 20 people in a group, the supervisors, when they're doing the telehealth, they would have to rotate through the pictures to make sure that everybody's sitting up, paying attention. If somebody is not showing up or logging on, or they disappear off site on screen, we had procedures in place to make sure that we did safety checks for the patients, which would be reaching out to trying to reach out to them directly, or one of their loved ones that we had a release of information for, or in some instances, we even had to call the police to go do safety checks on somebody because of things that happen in group. So training the clinicians on how to watch out for those new safety protocols, how to deliver certain things by telehealth. Some things became very challenging that we found solutions for, but they were challenging to begin with, like the experiential therapy, doing art therapy. We have an art therapy room here, so we had to learn how to do that via telehealth, which was our clinicians got very creative on having them use their own art supplies and stuff at home. We do a lot of exposure therapy here normally in the clinic. So we had to figure out how to do exposures, which was challenging, for certain populations, especially if, they have a social anxiety. Having them, normally we would have them go to the mall and maybe walk around and talk to a couple of strangers. Obviously during the pandemic, we couldn't have them do that. For extreme OCD patients, some of the exposure therapies we might have done in the past was a hand washing ban for somebody that, washed their hands excessively. Obviously, during the pandemic, we had to, lift that. We weren't going to tell people not to wash their hands.
Right.
So a lot of the, programs, did, struggle a little bit from the creativity side when we were first launching it on how to still offer exposure therapies that would be just as effective, but would be appropriate for telehealth in the pandemic. And through the standard work that Rogers as a company did on whole, which I've just been nothing but impressed by, they were able to come up with different measures in order to still do those exposure therapies and still deliver that same clinical effectiveness, but through a safe telehealth environment.
Awesome. George, I'll turn it over to you as we conclude a bit. But I'm pretty sure I've been hogging the microphone for a little bit, so I know you got some good questions.
Oh, no, that's all good. I mean, we're wrapping up our time. Any parting words of advice? I mean, for our audience in terms of transitioning to telehealth, in terms of getting back to normalcy. I know we talked a lot in the episode about some cultural elements that you think are important, but any kind of parting advice for our listeners?
Yeah, I mean, I would just say, if, continue to do, whether it's the pandemic or whether there's not a pandemic, the